Most people who have been diagnosed with chronic myeloid leukemia, also known as CML, can lead full and active lives with little or moderate side effects, as long as regular testing and monitoring is followed and all medication is taken as prescribed. For most of these people, it's even possible to achieve long-term remission of the disease. However, if not treated properly, CML is still a very aggressive, potentially deadly disease. If you are living with CML, it's important to closely monitor how your disease is responding to treatment to ensure the best health, the best possible treatment outcome, and a high quality of life. Regular testing is necessary, even if you have responded well to treatment, because it helps to ensure that you continue your good response. Your hematologist or blood cancer specialist will order regular tests of your blood and bone marrow to monitor this. There are several types of tests that you'll become familiar with as you manage your disease. A routine physical examination, which can help determine changes in spleen size. Hematological test, HT, or a complete blood count, which counts the number of normal blood cells in a sample. Cytogenetic test, CT, which measures the presence of the cytogenetic marker of the disease, the Philadelphia chromosome. Cells containing this chromosome are called pH-positive, pH+ cells. Molecular test, MT, which examines the presence of any remaining pH+ cells by detecting very small amounts of BCR-ABL protein. The results of these various tests will tell you important things about your CML, like the current phase of your disease and how well your treatment is working over time. Hematological testing consists of a complete blood count to count the number of white blood cells, red blood cells, platelets, and blast cells. A physical examination can be used to confirm an enlarged spleen, a symptom of chronic myeloid leukemia. Blood counts are usually done at diagnosis and will be repeated relatively often until they are in the normal range, then every 3 months. When the blood counts are in the normal range, and when the size of your spleen has returned to normal, you have achieved a complete hematological response, also called a CHR. The aim is to achieve a CHR during the first 3 months after starting treatment. If the tests show that your treatment isn't working or has stopped working, you may be experiencing treatment resistance. Resistance is when CML cells are able to grow and multiply, even with treatment. Your hematologist or blood cancer specialist may discuss other tests to help determine other treatments for you. As your treatment for CML progresses and your response improves, it can be harder to measure the presence of CML by blood counts alone. At this point, more sensitive testing methods will be used, both cytogenetic and molecular. Cytogenetic tests, CT, have a higher level of sensitivity. They will show if your treatment has reduced the number of pH+ cells in your bone marrow and blood cells. If the amount of pH+ cells is reduced by any amount, you have a cytogenetic response, also called a CYR. There are 2 types of CYR. A major cytogenetic response, or MCYR, is when the percentage of pH+ cells is reduced to less than 35% but more than 0. A complete cytogenetic response, or CCYR, is when pH+ cells are reduced so that none can be detected at the time of testing. A CCYR is a primary goal of your treatment. At the least, CYR testing is done at 3, 6, and 12 months after diagnosis, until CCYR is achieved, and then every 12 months. Your hematologist or blood cancer specialist will know when you should be having cytogenetic CYR testing based on your response to treatment. Once a complete cytogenetic response, or CCYR, is achieved, a molecular test, MT, will be used to learn important information about whether your treatment has been able to further reduce the CML cells in your body. This technique is usually preferred at this point because its sensitivity is higher and it can be performed on blood samples instead of bone marrow. Molecular tests analyze the level of a protein called BCR-ABL that is specific to leukemia cells and is not present in normal cells. The molecular test that measures BCR-ABL is called a polymerase chain reaction, often shortened to PCR or even qPCR. When levels of BCR-ABL are very low and meet a specific threshold, you have a major molecular response. Treatment guidelines indicate that molecular testing begins when you are diagnosed with CML. Molecular testing should be done every 3 months until a major molecular response is achieved. Then, testing should be done regularly, usually every 3 to 6 months thereafter, potentially with supplementary tests in between. Your hematologist or blood cancer specialist will monitor whether you achieve certain treatment goals by 3, 6, and 12 months, which may indicate whether your treatment is working or whether you may need to consider switching treatment. The right testing at the right time is critical for the best management of CML. Discuss with your hematologist or blood cancer specialist what tests you need when, where you should get them, and what your results are. As a CML patient, it is important to play an active role during testing and monitoring and throughout your CML journey. Consider these tips. Find a specialist who knows a lot about your disease and has treated many CML patients. Ask your doctor to explain the results of your diagnostic tests. In case you may want to ask another doctor for a second opinion in the future, having a record of prior test results may help you. Give your treatment time to work. Changing your treatment should be based on good data. Even if you feel you're in good remission, ensure your specialist keeps an eye on how well your treatment is working. Don't miss your regular checkups. Be sure to always talk to your specialist before interrupting or changing treatment. Make sure you take your treatment as prescribed. Only drugs that are taken can actually work. Never stop treatment until your doctor advises you to do so. To learn more about CML patient support and to find a patient advocacy group near you, visit the CML Advocates Network website at cmladvocates.net.